Welcome back for our second episode of Take Care with Blair. And I couldn't be more excited today about our podcast because we have one of our very own Mountain Health Co-op members, Doug Mitchell. Doug, thank you for being on the podcast.
Super excited to be with you, Blair, and thanks for taking on this great new task that you're undertaking as CEO. As a member, I couldn't be happier to have your leadership moving us forward.
Well, thank you for saying that. And okay, so for those of our members who are listening, tuning in, tell us who you are, a little bit about yourself and your background.
You bet. So my name is Doug Mitchell. I am the executive director of the Glacier National Park Conservancy, which, yes, is as good a job as you think it is. We get to be the nonprofit partner of Glacier National Park. So we fill in the gaps from public funding to help on any number of things, right? Scientific research. There's not enough money in the Park Service to fund some of those things. So we fund work on bears and bats and birds and lots of other things. We do educational work with our educational partner, the Glacier Institute, and others to provide for student field trips into the park, to promote and to pay for the Native America Speaks program, which allows each of us as park visitors to have access to listening directly to tribal stories from the indigenous people for whom this place is currently still their home and has been their home for 10,000 years. And then preservation pieces, helping fund the Montana Conservation Corps and trail repair work and weed work and things like that. This year, Blair will provide, thanks to public donations, $3.5 million worth of support to the project. And I do that with a group of coworkers who are an incredible group. And we rely on you guys on Mountain Health Co-op to help us create a culture of caring in our workplace that helps us then to do this work and to be healthy to do this work and to feel cared for as we try to care for this place that means so much to us.
Yes, Glacier is absolutely the very best place to visit. Just went there this last weekend. It did pour rain the whole time, but I thought it made the colors a little more vivid, like the green's a little more green. And it was just, you can't go to Glacier and not have the most amazing experience ever. So thank you for your work to continue to keep it just this gem in our country. So thank you for that.
Absolutely. You bet. We're happy to do it.
So how long have you been a member of the co-op?
We have been a member of the Mountain Health Co-op since the unfortunate day in March of 2020. So March of 2020 is a memorable time for all of us. And you can imagine my delight when I got a call that our health insurance was being canceled. So think about that in context of time, right? We have just all been sent home. We're in our basements. We are worried for our health and safety. And we are told on May 1st, we will no longer have health coverage for any of our coworkers. So we reached out immediately to, I think at the time, Montana Health Co-op, but Mountain Health Co-op, and through our insurance aggregator. And as has been the case ever since then, the answer we got was no problem. We got you. And so by May 1st, we had coverage for each and every one of us that was, robust and meaningful and affordable. And so this is our, I believe then, I'm not good at math, but this would be our coming on our 5th year of work with the team.
Wow. That would have been just a scary time for sure. So thank you for sharing that story. And something you hit on, your broker, your agent, your aggregator, as you said. I think a lot of startups wonder, or businesses wonder, how do I even get started with the process? So talk to me a little bit about using an agent, a broker, and how that worked for you.
Yeah, that's been super helpful for us to be able to have someone whose business is the business, right? That when when you're coming up to Glacier, for example, if you call me, I'm going to help you speed round this to being able, because I know Glacier like the back of my hand, right? So why reinvent the wheel and try and become an insurance expert, which although it is a very sexy set of facts that you want to learn, I'm sure. When there are people out there in your community, local people in your community whom you know, who you can call and say, here's our situation. Can you
Yeah.
help us out? And they're going to automatically or more quickly be able to connect you with the thing that's going to work for
Yeah.
you. And again, we're a nonprofit, so we're a little bit different. Our demography skews differently. I'm 63, but I have coworkers who are 21.
Yeah.
And so, knowing that through somebody
Yeah.
who is in our community is super helpful.
And I think a misconception is that you have to pay this person to do the work for you. The person, the agent, the brokers are paid by the payer, the health insurance companies, whoever they end up signing you up with is who pays for that. So it is really a free service to startups, nonprofits, organizations to use agents or brokers.
Right. I mean, think about all of us have done some sort of real estate transaction, right? Whether as a renter or a purchaser or a seller, and it's a similar kind of thing, right? A
Oh,
realtor is going to have access to buyers and sellers. Their cost is built into the cost
yes.
of the transaction, and you gain value as a customer by being able to have that value brought to the transaction. So does it end up in the transaction? Yes, it does. Should it? Yes,
Yeah.
because there's huge amount of value added,
Yes.
right? I mean, I could spend, my job is to raise money for the park. So time that I spend reading the fine print of Aetna, Blue Cross Blue Shield, blah, 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 is time I don't get to do my job.
Yes.
So I don't do my donors any favor by trying to pretend I'm saving money when I'm actually not, right? Because the
Yes.
product is going to cost the same. And again, I just feel nourished by the person, right? We know
Yes.
this person. They're great. They're in our world, and so that's a really nice relationship to have for sure.
Yeah. So how important, you're the leader in this organization. So how important is coverage to your overall compensation package and the ability for you to recruit employees?
Being able to provide benefits is more and more important, and I think it's a core value of who you are as an organization. And
Mhm.
so we're really pleased. I mean, it was just a no-brainer for us to say we're going to provide at least a portion of health costs to
Yeah.
everyone as a core part of our business model. So that's been really critical to us going forward, not just in terms of recruitment, although I think there is that. I think it's really, Blair, a value statement, right?
Yeah.
That you say to yourself, look, this is who we are. And I think it's the values piece. This hat I'm wearing right now has our values written on the back of it, right? And commitment, collaboration, inclusion, and respect, right? And so you have to live those as an organization. I think people looking to join causes or join big companies are looking to see whether that company shares their values, and
Yeah.
providing the ability, the on ramp to significant appropriate healthcare coverage that demonstrates that, I think is really that's more
Yeah.
important, I think, than the benefit itself, is the way the benefit interacts with the core values that you have as an organization.
Absolutely. Absolutely. Okay, so can you share then, and only what you're comfortable sharing, but can you share maybe a story about how health insurance made a significant difference either in your life or an employee, or, how has this coverage worked for you?
Yeah, I'm happy to do that. I'm guilty of oversharing on some occasions, but I promise not to make anyone feel uncomfortable. But I've had personal experiences in this case that I think are educational to me, and then I've watched the stress level for my coworkers be reduced by the fact that you have choice, right? So
Mhm.
in our Mountain Health Co-op opportunity, you're not one size fits all.
Yeah.
And so all of my coworkers have a choice to be able to choose family coverage, individual coverage, silver plan,
Yeah.
gold plan. And so being able to do something that's comfortable for them financially, that respects the place they are in their lives, right? I had mentioned I'm 63 years young. My needs are different than someone who is 23 years young.
Yeah.
And having choices for those people, I've watched that significantly reduce the stress of people who are having a child, are getting married, are having an injury, right? And being able to see how that impacts us. I will also say the preventive care that you guys encourage is also a change maker.
Yeah.
So it starts with me. Health checkups that are provided every year as part of our plan. Most of our people take advantage of those. The call-in check-ins with a physician or PA to go through that. Again, most of our people do that, and again, it shares our values. Personally, I had a moment as a 60-year-old male. We have a history of prostate cancer in our
Mm.
family. I've been tracking that very carefully, and
Yeah.
3-ish years ago, 2.5 years ago, you had the visit you don't want to have, where the doctor says you have prostate cancer.
Yeah.
And I'm sure there are people who are listening in who either have had a family member or have had that moment, right? One of the first things that goes through your mind after kind of the whole mortality thing happens is, can I afford this?
Yeah.
Am I about to file for bankruptcy, right?
Yeah.
And how am I going? Is this going to be hard? Am I going to be filling out forms? And one call to Mountain Health Co-op on like the next day, maybe it was even that day, had me on a path that was so nourishing to me
Yeah.
and so affordable to me that it's really been a remarkable and very positive experience in my life. And I don't want to drone on, but I'd be happy for you to kind of ask me another question, and then I could add some additional context maybe.
I think you should just add what you want to say. This is, you're speaking to our members.
Yeah, I just want to. I didn't really. I called a friend of mine
Yeah.
who is in this world. He's finances healthcare companies, and
Yeah.
so he hooked me up with his director, both an MD doctor and a PhD doctor in the specific field of prostate cancer, who said you can go to this handful of academic institutions to have this surgery, University of Utah being one of them. When I call Mountain Health Co-op, they say, we have a partnership with the University of Utah Health System. And if you'd be open to going to Salt Lake City to have this procedure, we would be happy to provide support to you, in financial support to you for making that decision,
Yeah.
including paying for travel and paying for lodging while we were there. And so as a result, Julie came down. My wife Julie came down with me. My son and his wife actually came and stayed with us as well for the week that we kind of recovered after the surgery. And I had this seamless experience with University of Utah. And again, and the guy at Utah was great. He said, there's no difference between me as a doctor and the doctor you have in Montana, right? We're the same person. In fact, they had trained at the same school. The difference is I've done this procedure, I don't know how many thousands of times. And every time I do it, afterward, I meet with medical students and we say, how can we do this better next time? Right?
Wow.
Because it's all I do, right? So, while you are a not-for-profit, part of the reason, obviously, I'm guessing that this was worth your investment is that the long-term outcome
Absolutely.
for you as an insurance carrier is financially better. And by the way, the long-term outcome for me is likelihood on a percentage basis much better. Again,
Yeah.
as he said, on any given day, the doctor you're going to have up there is going to use the exact same piece of equipment. He
Yeah.
has exactly the same training I do. Any given day, it's not like that person or those people are bad. And so that worked out so well for me. Took
Good.
all the stress out of the system. Ended up financially being something that was extremely affordable. The follow-up care has been amazing.
Good.
And I'm basically now getting fired by my surgeon because it's turned out great, right? I
Great.
don't
Which,
I prostate cancer is not going to be what gets me. I
yeah,
don't have one, and I don't have cancer. So that's really
yeah.
exciting. We share our time between Helena and our home healthcare community is Helena, and that's where we live, and that's where I will retire. And the further connection now between University of Utah and St. Pete's is also super helpful. I've
Yeah.
had a recent issue that St. Pete's doesn't have a doctor of that type there, but the University of Utah does. So again, transparent to me, all I had to do was get on the computer and talk to the physician who had all my files from St. Pete's. So this ability you guys have brought, or I shouldn't say ability, this connectivity to the broader healthcare world, and particularly to the academic world of healthcare provision, I think has been really,
Mm,
really, really important, and I think it's change making in Montana,
yeah.
and I really think that this is a leading edge product that is
Mhm.
more than health insurance, right? This is provision of services, again, consistent with my mission of my talk about values and vision,
Yeah.
right? This tells me about the values of my health insurance company. And it says to
Mhm.
me, this company cares about more than the check that gets to them every month. This
Yeah.
company cares about me as a person. And there is a positive feedback loop between my
Yeah.
being a healthy senior and the company being able to support its bottom line. And you guys recognize that connectivity and implement it in a way that is very transparent, but
Yeah.
also really enriching for me as the customer.
Yeah. Hmm. And that's what the co-ops were designed for. And sadly, there's only two. There started with, I think, 23 or 24, and there's only two surviving co-ops left. And part of our mission and who we are is to operate on such a very thin margin, but any profits are reinvested back into our membership. And because we are a co-op, people have a say and a seat at the table. And so many of those benefits were created by our members. Hey, we need this. We're seeing a need in rural health where we don't have access. How can you find this, bridge this gap for us? And so that's how many of these benefits have come to be through our members and the shared values of, hey, let's lock arms and take care of one another, because if we don't have solid communities, I mean, what do we have? We have nothing. And so I think that starts really with one, education, and two, health. You have to have healthy people to have healthy communities. So appreciate you
Yeah,
shared your story.
and I would say, and I know this is on the radio, but I'm taking off my hat again and turning it around. I think Mountain Health Co-op could have these same words, right?
Yeah.
That I think you've demonstrated commitment and collaboration, and certainly respect for your customers and I'm sure your team, and inclusion, right?
Yeah.
We don't get asked what color anybody is or what their pronouns are. We just get covered. Like the day somebody starts,
Yes.
they're covered, man. And so I think that values connectivity is really important. And since I have the microphone to speak directly to
Yes.
customers, and my fellow customers, like, look, I know we're all kind of hesitant. You get a call on your cell phone from somebody who says we want to schedule an appointment, or your HR department sends out the thing for um, you know um, uh, it starts with me. Pardon me, I was
Yeah.
remembering that. And or you get the Birdie Pharmacy. I don't know that
Yeah.
that's universal, but there's a reason you're getting those, and the reason is it's best for everyone if you use them. So
Yes.
do not pass go. Do not collect $200. Answer the phone. Make your appointment when they ask for an update. And by the way, that's a really positive financial outcome there. Two, it starts with you. I mean, that's where I started to find my PSA was 9.5, like, and a free deal.
Yeah.
And And then I call the urologist who says, you need to come. So that's early detection right there. And, I love my local pharmacist, but I tried Birdie. And 2 of my 3 prescriptions that I take are $0.
Great.
So not close to zero. Right. And I wouldn't know that unless I did it. And the reason you have the opportunity to do it is because experts like Blair and her team know that it works, know that it saves them money, saves you money, and all of us as a co-op, right? This is how we're going to be able to keep having single-digit rate increases instead of double-digit rate increases, is by taking care of each other, right? So use these opportunities that you have to again, to collaborate, call and ask questions. There are people who are there to answer your questions, and use these systems, because in my case, that's how I found out I had cancer. And I've saved money. And the first one I wouldn't really recommend, but the second one, the saving money, I highly recommend.
Yes. Well, sheesh, Doug, if it doesn't work out where you're at, I feel like you could be our top marketer, because that was beautifully said. We're all in this together. We save money together. We take care of one another. We're able to lower those costs to you, the members, and do take advantage of those types of things. The zero preventive list, hundreds of medications are on that. Porter Health does the in-home health assessment. It's free to you. Plus you get $50 check from us to just do it, because we want you to do it. The $100 dental exam reimbursement, $60 eye exam. We have had members who have found cancer through that eye reimbursement, that eye exam. It's so important. So use those benefits. They're there for a reason. And you answered so many of my follow-up questions, but I do want to say, I always like to end with some fun questions. So the first question is, what books are you reading now? I know you're a reader, right? You can just tell. But if you're not a reader, what shows are you watching or binging right now? Or what books are you reading?
Am I not a book reader? Okay. So right now, my goal this year is to read 100. So I am a book reader. I am reading an extraordinary book right now by Doris Kearns Goodwin, and she is a presidential historian. People may be familiar with her. Her first book that made her famous was about Lyndon Johnson. This is a love story and a great history. Her husband, Dick Goodwin, was also a speechwriter for Kennedy and Johnson, and then Bobby Kennedy. And so they, in her 70s, his 80s, went into their garage where he had all of the stuff from the 60s boxed up, and he really had not been able to go back to it, because keep in mind that he was there at the bedside when John Kennedy died. He was there at the bedside when Robert Kennedy died. He had met and spent time with Martin Luther King. So he hadn't been able to really feel like he could. So this is the story of them going through these files and not getting through them before he dies. And so it's called An Unfinished Love Story. And it, for anybody who is a student of the 60s, who's super interested in this, I mean, I think it's a remarkable book. Doris Kearns Goodwin, anything she writes is terrific. The other one I'll throw on people's reading list, I'll go Glacier. There's a series of Glacier mystery stories by Christine Carbo. So if you're on the fiction side, you dig into Christine Carbo, who has 4 books that are all mystery stories that are in Glacier Park. And so it's really cool to kind of be able to take a beach read. So I give you one serious read and one beach read, or set of beach reads.
Okay, I love it. And your last question, because you are a dad, because you talked about your kids, right? You have kids. What's your favorite dad joke?
Why was the whale sad?
Why?
Because he lost his porpoise.
Okay, folks, that's Doug Mitchell. Thank you for being on the podcast. I appreciate you so much.
Thank you, Blair.